Yeah, hello everyone. So as I told before, we will be discussing the custom modules, and already I have given the link in the Telegram group, so you can check out in the story as well. In the Telegram group, I already given the code. So we will be discussing actually 25 MCQs. So let's begin. So the first MCQ what we have is first of all, I don't know, even send me a request for live video beforehand only, so I cannot accept right now, sorry. So what I was telling, we will be discussing 25 MCQs, and I hope it is audible. Hello. So the first MCQ we are having is what is the gold standard investigations to confirm acoustic neuroma? So the options are CECT, gadolinium enhanced MRI, X-ray or biopsy. So the question I will repeat, what is the gold standard investigation to confirm the acoustic neuroma? CECT, gadolinium enhanced MRI, X-rays or biopsies? So anyone? Why? Okay. The answer is B. Yeah, it is MRI with gadolinium. Yeah, it is audible. So yeah, it is gadolinium enhanced MRI is the answer, which is a gold standard investigation for acoustic neuroma. So next question what we have is, it is a biochem question basically. The group of enzymes that catalyze the joining together of two molecules are called as transferases, ligase, oxidoreductase or lyase. It is also very simple basically. The question is group of enzymes that catalyze the joining together of two molecules. Transferase, ligase, oxidoreductase or lyase. So anyone? It's quite easy question. Ice-cone appearance is seen in acoustic neuroma. Yeah. So anyone wants to answer this question? The question is group of enzymes that catalyzes the joining together of two molecules, transferases, ligase, oxidoreductase and lyase. So I think no one. The answer is very simple. It is ligase. Basically, two molecules are joined together by ligase, and we have others. What we have here is transferase. So what is the transferase? Is basically it catalyzes the transfer of one to another, as the name suggests. And then we have lyase. It will cleavage of the molecules. Then what we had the other options, oxidoreductase, that will catalyze the redox reactions. So the next question what we have, what is the classical immunophenotypic picture seen in patients with CLL, that is chronic lymphocytic leukemia? What is the classical immunophenotypic picture seen in patients with CLL? So the options are, I know it's quite difficult, CD19 plus, CD20 plus, CD21 plus, CD22 plus, CD23 plus, CD5 plus. I don't know if anyone will be able to answer this question. So basically the phenotypic features are around CD19 plus, CD20 plus, 21 plus, 22 plus, 23 plus, CD5 plus. So this, you have to remember this, you cannot do anything about this. Then next question what we have is, which of the following is the most common cause of pain in osteochondroma? It's orthopedic. Which of the following is the most common cause of pain in osteochondroma? Nerve compression, fracture, malignant transformation or bursitis? I will repeat once again, it is nerve compression, fracture, malignant transformation or bursitis. So anyone, what is the most common cause of pain in osteochondroma? B, no, fracture is not the most common cause. Nerve compression also is not the most common cause. Anyone else? See, the answer here is bursitis. Bursitis is the most common cause of pain in osteochondroma. So, do you know what is osteochondroma? Basically, it is benign bone tumors which are nerve compression, which are developmental malformation arising through neoplasm. Basically, it is a benign bone tumor. So the next question, bursitis. Next question what we have is, you are tasked with giving post-operative care to a patient who just underwent open abdominal surgery. Which of the following is the most effective treatment to prevent the patient from developing DVT? Basically, a patient went for abdominal surgery and you were monitoring the patient. So, what will be the most effective treatment to prevent the patient from developing DVT? So, the options are early ambulation, physiotherapy, prophylactic heparin, low dose aspirin. You might be seen always in the wards. I will repeat once again. Suppose you are giving post-operative care to a patient who has just had abdominal surgery. So now what will you do to prevent DVT from developing DVT? Early ambulation, physiotherapy, prophylactic heparin or low dose aspirin. So anyone wants to answer this? B. No, physiotherapy is not the answer here. B. No, the answer is prophylactic heparin. Basically, see, heparin, what we know is especially low molecular weight heparin is more effective for prophylaxis in DVT who have undergone major surgeries. The choice of prophylaxis depends on the type of surgery, trauma and duration of post-operative immobilization. Major trauma, abdominal or orthopedic surgeries warrant a longer duration of post-operative immobilization, so the pharmacological method is preferred. Heparin only. See, no, it is basically major trauma, abdominal or orthopedic surgery. You have to give prophylactic heparin. Others you can give that what you said, physiotherapy and early ambulation. But if you have major surgeries, orthopedic and what else? And trauma. So next question we have. Then we have, you are posted in a PHC in a coastal region as a part of your rural posting. Which of the following Anopheles species is most commonly found here? Basically, you are in a coastal region. Which of the following Anopheles species is most found here? Anopheles philippines, Philippinensis, Anopheles stephensii, Anopheles fluatilis, Anopheles calcifacis. It is a PSM question. So, in the coastal region, Anopheles species most common is anyone? So there are two species which are most common. See, the species which is common here is Anopheles stephensii. What is given in the options? So the two species here is Anopheles stephensii and Anopheles sandicus. This you have to remember. You cannot do anything. See, Anopheles calcifacis and Anopheles philippinensis is found in plains, whereas Anopheles fluatilis and Anopheles minimus is found in foothill regions. Philippines is found in plains. So here only coastal region Anopheles stephensii and Anopheles sandicus. So next question what we have is a patient with a history of blunt trauma is brought to the casualty and EFAST examination is performed. Which of the following statement is about the investigation is false? False statement about the investigation. So B line indicates a normal ultrasonographic finding of the lung. Stratosphere sign is seen in M mode USG is indicative of pneumothorax. It can be reliably used to detect less than 100 ml of free blood. It is unreliable for the assessment of retroperitoneum. Basically, patient comes with history of blunt trauma, you are doing EFAST. So which of the following is false? See, B lines indicate a normal ultrasonographic finding of the lung. Repeat the question. So I will repeat again. A patient comes to you in the casualty with the history of blunt trauma and you perform the EFAST examination in the casualty. So which of the following about the investigation is false? Okay, the first option is B lines indicate a normal ultrasonographic finding. B lines indicate a normal ultrasonographic finding of the lung. Stratosphere sign seen in the M mode USG is indicative of pneumothorax. It can be, third one is that it can be reliably used to detect less than 100 ml of free blood, and fourth one is it is unreliable for the assessment of retroperitoneum. So I hope you understood the question. So the answer here is, if anyone wants to answer, I will wait. Okay, I'll tell the answer here. See, the false statement here, last one, or not the last one, and last one, not the false. See, the first statement here is that it can be reliably used to detect less than 100 ml of free blood, because it is not reliable. If you have a less than 100 ml of free blood, it is not reliable. EFAS is not reliable. Okay. Then others are all right. It is unreliable for assessment of retroperitoneum. Yeah, that is also right one. So next question what we have is, as per the syndromic approach of STDs, sexually transmitted infection and reproductive tract infection (RTIs), what is the treatment of choice of gonococcal and non-gonococcal urethritis? So the options are azithromycin plus metronidazole, cefixime plus azithromycin plus doxycycline plus cefixime. Okay. So the question here is, as per the syndromic approach of STDs and RTIs, what is the treatment of choice of gonococcal and non-gonococcal urethritis? Azithromycin, no. Cefixime plus azithromycin, yeah. Second one is the right answer. See, as per the syndromic approach, the treatment of choice is azithromycin plus cefixime. That is as per the guidelines. Here B is the right answer. Again that, okay. Next question what we have is, which is the most abundant form of collagen in the dermis? This in the afternoon only I said. If you are there, which is the most abundant form of collagen in the dermis? Type 1, type 2, type 3, type 4. Which is the most abundant form of collagen in the dermis? Type 1, 2, 3 or 4? Anyone? Okay, and then we have to remember this. Type 1 is the most common abundant form of collagen in the dermis. Type 2, no. Type 1. Okay, the next question. Yeah, type 1. So next we have, you are observing electroconvulsive therapy being administered to a psychiatric patient. Which of the following statement is true regarding the procedure? And options are, an ineffective seizure should last for at least 2 minutes. ECT treatments are usually administered twice or thrice weekly non-consecutively. Third option is, maximum number of times ECT can be given in a patient sits. The last one is all the above. Basically ECT is electroconvulsive therapy. So which of the following statements is true? I know most of you will tell all the above, but all the above is not the right answer. So I will repeat which of the statement is true regarding the procedure. First is, an effective seizure should last for at least 2 minutes. ECT treatments are usually administered twice or thrice weekly non-consecutively. And third one is, maximum number of times ECT can be given is sets. And last is all the above. So anyone wants to answer? Okay, the answer here is second one. That is, the ECT treatments are usually administered twice or thrice weekly non-consecutively. That is the true. Other one are not. And see, the first option was, an effective seizure should last for at least 2 minutes. But no, it is like, for doing a ECT, for a seizure, it should last for at least 25 seconds, not 2 minutes. So that answer is gone, all the above is gone. Then maximum number is not as sits. Maximum number is, if the patient does not improve, it is 6 to 10 basically, not exactly sits. So next question we have, what dye is used for diagnosis of esophageal perforation? And this one I think everyone should know. Maybe not. So the options are gastrografin, iodoxazole, gadolinium, barium sulfate. Which dye is used for diagnosis of esophageal perforation? Gastrografin, iodoxazole, gadolinium, barium sulfate. Anyone? This is a recent need question. Drug of choice. Barium sulfate, no. Barium sulfate is not the answer. No. The answer here is Iosetsol. See, what they have given is, see for barium peritonitis, for gastrolafin. No. The answer is B, Iosetsol. See, for perforation peritonitis, they have given gastrolafin. That only is okay. So for the diagnosis of esophageal perforation, the dye we use is Iosetsol. Next, what we have, a patient with uncontrolled diabetes is diagnosed to have diabetic macular edema. Which of the following anti-VEGF therapies is effective in the treatment of this condition? So the options are bevacizumab, ranibizumab, aflibercept, ramucirumab. So I'll repeat the question. A patient with uncontrolled diabetes comes to you. Now it has been diagnosed to have diabetic macular edema. Which of the following anti-VEGF therapies is effective in the treatment of this condition? No, it is not bevacizumab. The options are bevacizumab, ranibizumab, aflibercept and ramucirumab. No, A is not the answer. The answer here is C. That is aflibercept. See, what they have given is aflibercept is more effective in diabetic macular edema in patients with worse baseline values of visual impairment when compared to what you said, that is bevacizumab and ranibizumab. So it is more effective and superior. Yeah, the answer is C. Next question. Who comes under category 3 non-heart beating donor? Who comes under category 3 non-heart beating donor? Then the options are a patient who died during transportation up to the hospital, a patient who died after failed resuscitation after reaching the hospital, a patient who was brought dead to the hospital, and a patient who was written to the hospital. So who comes under category 3 non-heart beating donor? So 3 is not the answer. See, I will repeat the options. Who comes under category 3 non-heart beating donor? A patient who died during transportation to the hospital, a patient who died after failed resuscitation. Am I audible? Yeah, and this is disturbing a lot. Okay, and a patient who is waiting death in the hospital. So the answer here is a patient, that is D. That is a patient who is awaiting death in the hospital. Comes under category 3 of non-heart beating donor. Basically, they have given all the categories from category 1 to category 5. And in category 3 it comes that it is who is awaiting for the. If you want, I will tell all the categories. See, category 1. What is category 1? It includes victims of the accident and suicide who are found dead at the scene. Dead at the scene, it is category 1. Category 2 is victims of sudden cardiac or cerebral catastrophe and who died in the department. Okay, category 3 is patients who are dying, often in an ICU. Okay, category 4 is who suffer unexpected cardiac arrest and they have caused brain death. Then category 4 is that only. Category 5 is unexpected cardiac arrest during intensive care. So I will change the question. Now next question is, a farmer presented with complaints of redness and excessive water in the right eye. Then you do a slit lamp examination. Slit lamp examination reveals the following finding. What they have given an image is there. That is, there is some opacity in the center of the lens. So the microscopy of the corneal ulcer scaphen shows branch septate hyphae. Which of the following drugs can be used in the treatment of this patient? Nystatin 3.5%, fluconazole 0.2%, natamycin 5% or oral voriconazole. I will define the question if you want. Let's say a farmer presented you redness, that is watering from the right eye. Slit lamp, what they have shown is that there is an opacity in the center of the lens. In microscopic corneal ulcer scraping, they have shown branch septate hyphae. Which of the following methods can be used in the treatment of this patient? So the answer here is, if you want to answer anyone. See what they have given is the diagnosis. What they have given is mycotic keratitis. Mycotic keratitis is a diagnosis for this. So the answer here is natamycin 5%. Natamycin 5% suspension is the drug of choice in this condition. That is, we have mycotic keratitis, fungal corneal ulcer is there, which shows what I have already showed. One is not, no, nystatin 3.5, no. Natamycin is the answer. See what they have, basically it is a case of mycotic keratitis which have branch septate hyphae as seen, I already told that. Next question, what we have, a 28-year-old woman presents with you with a 3-day history of mucopurulent cervical discharge. The RAM staining of the discharge reveals numerous pus cells but no organisms. What is the investigation of choice for a diagnosis of this infection? I will repeat the question. 28-year-old, okay, 3-day history of mucopurulent cervical discharge. We do a RAM staining and discharge reveals pus cells is there but no organism is there. What is the investigation of choice? Saline mount, serum antibody testing by immunofluorescence, culture in Thayer-Martin media, or nucleic acid amplification test. This at least someone should answer. What is the investigation choice for this? That is saline mount, serum antibody testing by immunofluorescence, culture in Thayer-Martin media, and nucleic acid amplification. Okay, I will tell the answer. The answer is D, that is the nucleic acid amplification test. So basically on the clinical scenario, what they have given, S is what? Saline mount? No. D is the answer. See, basically whatever the history they have given, it shows to a acute cervicitis. Okay. And what they have given is, as Dramsien doesn't show any organism, gonococcal infection is less likely. Okay. In this case, Chlamydia trachomatis is the most likely organism. For C. trachomatis, the investigation of choice is nucleic acid amplification test. Basically, no organism, so no gonococcal infection. Now we move towards Chlamydia trachomatis, and that investigation of choice is nucleic acid amplification test. Next, what is the question is, which of the following statements is not true about Tay-Sachs disease? So the options are: affected infants are normal at birth. There is involvement of neurons in the central and automatic nervous systems and retina. Stains for, third option, the stains for fat such as oil, redo, and Sudan black B are positive. Then D is Wold configuration with mitochondria composed of onions thin layers of membranes are seen. See, many of you are sending the request for video, but sorry, beforehand you have to tell so that I will accept the request videos. So which of the following already said? Anyone? Which of the following statement is not true about Tay-Sachs disease? So what is Tay-Sachs, if anyone wants to tell? It's a syndrome basically in infants. Okay, and which of the following is not true here is the last one, that is the Wold appearance configuration within mitochondria composed of onions thin layers of membranes are seen. It is not mitochondria, we have to remember it is within lysosomes, that is composed of onions thin layers of membranes. So the last one is the wrong one. So basically it is there in the infants. Affected infants are normal at birth. Okay, then no involvement of CNS and ANS and retina, and the stains for fats such as oil, redo, and Sudan B are positive. And here one more is there, that is cherry red spots appears in the macula. It is a storage disorder. Next question. Okay, it is a pediatric question. A baby is assessed 5 minutes after birth. It is found to be cynosed with irregular gasping respiration, heart rate 60 beats per minute, and grimace is seen with some flexion of extremities. What is the Apgar score? This is the one question that we will be covering like this. See, a baby 5 minutes even assessing 5 minutes after birth, cynosed with irregular gasping respiration, heart rate 60 beats per minute, grimace is seen with some flexion of extremities. What is the Apgar score? 2, 5, 3 and 4. You have to calculate that. The table is anyone wants to answer this Apgar score? In the food table you have to remember in this, otherwise the score here is 4. I'll tell you how. See, the color, first we have to go to color. Color is blue, that is cyanosis there, it is blue. That is, for color it is 0. Heart rate, the score is 1. Why? Because it is less than 100 beats per minute. Here they have given 60 beats per minute. Then grimace is there, okay, that's 1 point you have to give. Flexion is there, that's also 1 point you have to give. Yeah, 4th is the answer. And irregular respiration, that also 1 you have to give. So 4 is the answer. And you have to remember the whole table for basically getting the Apgar score. Okay, this orthopedic question, I think. Yeah. A 38-year-old male patient come to you with a painful arm and is attempted to lift a 50 kg dumbbell with his right hand. On examination, there is an abnormal bulge over the arm as shown in the image below. Which of the following tendon is most likely to be injured? Basically, in the arm there is one swelling is there, like you have seen Popeye, like that only. Okay, the answer, which of the following tendons to be most likely to be injured? The options are brachialis tendon, distal tendon of bicep, proximal tendon of bicep, long belly of biceps. Anyone wants to answer this? 38-year-old patient is there. He was attempting to lift a 50 kg dumbbell on the right hand, but whatever happened, there is now a normal bulge in the right arm. So which tendon is most likely to be injured? Brachialis tendon, distal tendon of bicep, proximal tendon of bicep, or long belly of biceps? Yeah, Popeye sign, that only I was telling. Anyone knows Popeye sign is seen in which tendon rupture? See, Popeye sign is basically seen in proximal bicep tendon rupture. It looks like same, it will be proximal bicep tendon rupture. And what is the Popeye sign? I will tell you. See, Popeye sign, basically when you flex the elbow, there is a seemingly prominent bulge of the muscle belly as it is unrestrained fibrous contact. Biceps. Yeah, bicep is there, but the question is which part of bicep? Proximal part of tendon of bicep, long belly of bicep, distal tendon of bicep, brachialis tendon. Yeah, proximal part of, yeah, that only. Popeye sign. Now next question. A 36-year-old housewife is scheduled for an excision biopsy of a breast lump under general anesthesia. The procedure is planned on a OPD basis. Which is the intravenous induction agent of choice for her? Ketamine, thiopentone, propofol, etomidate. Anyone anesthesia question? 36-year-old scheduled for excision biopsy of a breast lump under general anesthesia, but it is a OPD basis. So which intravenous agent we will use? Ketamine, thiopentone, propofol, etomidate. Okay, the answer here is, I don't think anyone. Okay, the answer is propofol. Basically, it is a choice for ambulatory anesthesia. Yeah. Why it has a rapid onset? The video is getting paused. Okay. Besides, propofol has anti-emetic properties which help reduce post-operative nausea and vomiting. So 2 points are there. Then, see, the question is, the ultrasound of a young woman with infertility is suggestive of uterine anomaly. Which of the following is used to confirm the diagnosis? Ultrasound of a young woman with infertility is suggestive of uterine anomaly. Then the investigations are hysterosalpingography, hysteroscopic plus laparoscopy, only laparoscopy, or transvaginal sonography. This uterine anomaly, what will you do? This, yeah, at least someone should answer this. There is a uterine anomaly. Which of the following is used to confirm diagnosis? Hysterosalpingography, hysteroscopy plus laparoscopy, only laparoscopy, or transvaginal sonography? HSG, HNL, hysteroscopy plus laparoscopy. Yeah, that is right. HSG is not. No, HSG we don't do. See, what you said about HSG is HSG provides information about the interior contour of the uterine cavity but cannot accurately visualize the external contour of the uterus. So for that we have to do hysteroscopic plus laparoscopy both to confirm a diagnosis. Next we have only 5 more to go. A middle-aged female patient presents to you with slowly progressive motor weakness, nuchal rigidity is there, difficulty in swallowing and carrying out day-to-day activities. A provisional diagnosis of multiple sclerosis is suspected. Which of the following cells are affected in multiple sclerosis? Microglia, oligodendrocytes, astrocytes, or ependymal cells? Basically, overall first all lines are waste only. Only you have to tell which cells are affected in multiple sclerosis. Microglia, oligodendrocytes, astrocytes, or ependymal cells. Yeah, anyone? Yeah, oligodendrocytes. In this we have to remember. Cannot do anything about it. So oligodendrocytes are the cells that are affected in multiple sclerosis, and what all they have given, they are just the clinical features. Motor weakness, nuchal rigidity, difficulty swallowing, carrying out day-to-day activities. The next question. The estimation of stature of an individual can be made from the length of the femur by multiplying the length of the femur with 3.74, 3.90, 3.56, 4. So you have to estimate the stature of an individual from the length of the femur by multiplying the length of the femur with 3.74, 3.90, 3.56 or 4. This you have to remember. Yeah, 3.4 is the answer. 3.56 no. 3.74, yeah, right only. 3.74 is the answer. So you just also have to remember 3.74 have to multiply so that you get. Then next question. A prime gravida comes to you labor room 40 weeks plus 5 days gestation for induction of labor. 40 weeks plus 5 days. On per vaginal examination, the cervix is 1 centimeter dilated and is 30% effaced. The vertex is at -1 station, and the cervix is soft and posterior. What will be the Biceps score for this lady? 0, 3, 5, 8. This is also one table you have to remember. I will repeat the question. Primary gravity is there 40 weeks plus 5 days. On vaginal examination, 1 centimeter dilated cervix, 30% effaced, -1 station, and the cervix is soft and posterior. What is the Biceps score? Biceps score. 3, no, 3 is not the answer. The answer here is 5. Now let's see the full table actually. So you have to look into that each. So I cannot explain each and every, and dilatation is one to. You have to look at the full table. If you want the question, I have already given in the Telegram group the link, so you can see there. Next we have a 73-year-old man comes with the complaints of malaise and low-grade fever. He has generalized lymphadenopathy. Histopathological examination, the lymph node is shown below. Which of the following does not indicate a poor prognosis? So deletion of 11q and 17p, lack of somatic hypermutation, expression of ZAP70, absence of Notch1 mutation. Since on the pathology, whatever they have given the picture, I can tell you it is CLL. CLL I can tell you, other things you have to decide. 73-year-old man, malaise, low-grade fever, generalized lymphadenopathy, and which of the following indicates a poor prognosis? Deletion of 11q, 17p, lack of somatic hypermutation, expression of ZAP17, absence of Notch1 mutation. Okay, the answer here is that is the absence of Notch1 mutation will have poor prognosis, and others, this, it's all you have to remember all this. Can't give an explanation for that. So the last question for today. A 41-year-old female presents with you with 1 month history of photophobia and foreign body sensation in the right eye. She had been using some combination antibiotic steroid drops procured from the local pharmacy for the past 2 weeks, which gave some initial relief. Now, slit lamp was done, which shows a corneal ulcer is there. The culture of the corneal scraping grew a filamentous fungus identified as a Fusarium species. What would be the drug of choice in this case? Natamycin, nystatin, fluconazole, amphotericin B. Basically, diagnosis is given, that is a corneal ulcer is there. And when you do a scraping, it has a filamentous fungus identified as a Fusarium species. What is the fungal infection? Corneal ulcer is there. What is the drug of choice? Natamycin, nystatin, fluconazole, amphotericin B. Last question, anyone? So it is a fungal infection. But you have to know the investigation, drug of choice for this. The answer here is natamycin. Natamycin 5% is the drug of choice for the condition which is given here is fungal. Nystatin no. Nystatin was there in the last question we discussed, 10 questions back I think. The natamycin is the drug of choice. What it is? It is a filamentous fungal keratitis. Fluconazole also is not there. It is a filamentous fungal keratitis. See what they have given is amphotericin B. Nystatin no. See, amphotericin B is the first agent of choice against yeast. If it is a yeast, then you have to write amphotericin B. Then yeah, that's all. Nothing. So natamycin 5% is for the filamentous fungal keratitis. So yeah, we have done 25 MCQs. So thank you so much for joining. Let's hope we'll meet you tomorrow.